Hi, Lynn.
Hello.
Hello, Lynn.
Hi.
Hi, lovely to meet you. Oh, you've gone a bit
Oh, there we
blurry.
go.
Hi, hi, hi.
Hi.
Hi, I feel like I know you, Lynn, because I've been to so many birth healing summits. So it's really weird.
I get that a lot, Abby. I get that a
Yeah,
lot.
yeah. It's really nice to like meet you in person.
Yeah, nice to meet you too. So tell me more about what's our focus with the summit? What's my I
So the
need to
focus
understand.
the focus is women with pelvic floor dysfunction. So at any stage in life. So whether
Okay.
that be postnatally, prenatally, menopause. So we're
Okay.
just and the kind of focus about all of this is really thinking about how what tips or suggestions you would give them, um, what things to look out for, what you do, because we want people
Okay.
to be able to find you.
Yeah. Yes.
Um, because what we're trying to do is show women, a bit like what you do at the Birth Healing Summit, that there are lots of different mediums
Yeah.
that they can get in touch with. And it's not just, I mean, my focus is hyperpressives and fitness, but I know that you do a myriad of amazing things. So
Oh,
we'd really like you to talk about that, if that's
okay.
okay.
So
And I guess,
our audience are moms.
yeah, they're mainly moms, but some of them have some of them have
Yeah.
issues without having had babies as well.
Oh,
So
okay.
there's a
Okay.
bit of a mix, but you talk to the mums if that's, because we've
Okay.
got other
Yeah.
speakers who can talk to the ones that aren't mums,
Yeah.
So
Yeah. Yeah.
yeah,
Yeah. Yeah.
yeah. So
Okay, so
yeah,
mainly pelvic floor dysfunction, right? That's our
yeah,
focus. Okay, because
yeah.
yeah, I want
You've
to
got
what I'd like to talk about how birth impacts the
yes,
function of our
perfect,
pelvic floor. Um,
perfect.
because yeah, there's a myriad of things that could be going on. How long are the interviews?
So
How
the
long are we?
interviews are about 45 minutes,
Okay,
45, 50
okay,
minutes, yeah.
okay, okay,
And
cool.
I guess at the beginning, a little bit of a little bit of an introduction of you.
Yeah.
I'll say a little bit, but I'd like you to, because you've got so many skills, Lynn. Like, and my perimenopause brain cannot contain everything.
Yeah.
You know? So yeah, that's where I'm at. Yeah, and a little bit about why you got into this kind of work as well. So a little bit about you, your business, where you
Okay.
are, how people can get in touch with you, all of that sort of thing. Yeah.
Okay. Sounds
Okay,
great.
so
Yeah.
shall we get started? I'll just start with a wee intro. Usually I've got a wingman, so usually Mahesh is here as well. So Mahesh is
Okay.
coming at this from the point of view of partners supporting women.
Oh, great.
So if there's anything you can suggest for them as well, because that's a big part of this, is
Okay.
giving support for women through their partners as well. If there's any
Okay.
tips for them too.
Yeah, yeah, yeah. Yep. Okay.
Cool. Excellent. So it's lovely to be here again with all of you. And this is today. I'm really, really excited because this is a practitioner that I really feel that I know, and I don't know her. She doesn't know me.
You
So
do.
Lynn Schulte does the birth summits, the healing birth summits, and she has the Institute of Birth Healing, and it's in Colorado, isn't it, Lynn? I
Yeah.
have remembered that right. Good.
Yeah.
So I'm gonna let Lynn tell us a little bit more about herself, and what she does, as she has so many skills, guys. So I'm really looking
Oh,
forward to hearing about them.
thanks so much, Abby, for having me. I'm so appreciative of any opportunity I get to be able to share what I know, to help moms, to help women in general, to be as strong and as functional and as healthy as possible. So, I am a pelvic health physical therapist. I've been one for 30 plus years. I stopped counting at 30. I figured that's enough. We don't need to number it. So 30 plus years of practice. The majority of that has been in working with pregnant and postpartum women. And I started when I moved my practice from Seattle to Boulder, Colorado, and I had to start all over and getting clients in the door. And I just started seeing postpartum clients. And that was the only population, the only people that I was seeing. Whereas other practices, you see a little bit of everything,
Yeah,
older women, younger women. I was only seeing postpartum, which allowed me to find the patterns that I was seeing in every single client that was laying on my table. And so I think that's gave me a really unique perspective
yeah,
in learning what's going on. And I used the curiosity of what I was feeling in that postpartum body to discover that there's a lot of patterns that I kept finding in every single person. And so then I started putting online, hey guys, this is what I'm finding in the postpartum body. And then I was getting emails from women all over the world going, oh my God, can you help me? And I was like, Not really. I mean, and so just like, they're like, do you know someone who can help me? And I'm like, no, not really, because what I know is what I've discovered myself. I didn't learn it from someone else. And so so then back in 2016, I realized I can't see every woman in the world. So I need to train other body workers about what I know so that they can go do it. And
Yep.
in 2016, I founded the Institute for Birth Healing. And I have since been traveling the world training other body workers. Anybody with a license to touch can take my bodywork courses and learn about these patterns and learn how to affect these patterns to release them from the body. And really what was happening was I was having women coming in with back pain, pelvic pain, and
I
in
was going
one
to
session,
ask what the patterns were that you're seeing, because I'm sure that a lot
I'll
of women here are going to, once you start talking about the patterns, are going to realize that this is something that they've got in their bodies as well, and this is where their bodies are feeling.
absolutely. So, and I will talk about those.
Yeah,
Um, but they were having these back pain, pelvic pain, and they would get off my table in one session and they'd be pain free.
that's
So
amazing.
I knew I figured something out. And
Yeah,
so
totally.
I got something here. And so what I realized is that as I was palpating the pelvis, I was like, why is this bone doing this? And why is this here? Shouldn't it be here? And why is it not moving? And so then I went back and I studied like what happens to the bones during birth.
Yeah,
And your sit bones, the bones you're sitting on, have to widen for the baby to come out, and your tailbone has to lift backwards. So your sacrum and tailbone have to go into what we call flexion in order for that to widen the pelvic outlet for baby to come on out. And I started to see this, but then I noticed like one sit bone was more out to the side than the other. And I'm like, why am I finding this? And it took me a couple of years to figure out what I was actually feeling. And it really depended on the position the person was in when the baby came out,
oh my
the
goodness.
impact that it has on the pelvic bones. And so, being a physical therapist and understanding the biomechanics of the pelvis, I was able to put two and two together, my palpation skills and what I know about biomechanics, and go, oh, this is what's happening. And so, let's say someone is they're laboring on their left side, and and they've got that right leg kind of, maybe someone supporting it, or it's up. Well, because they're on that left side pelvis can't move, and so the right side has to move more. And so that ischium is going to be more out to the side. The right side is going to be more splayed than the left side. Whatever leg is bent up more, that side's going to be more pushed out to the side. And so sometimes women can feel like, oh my gosh, I just don't feel like I sit evenly anymore. Well, that's because one ischium is a little bit more out to the side. If you're stuck in sacral flexion, you do not like laying on a hard surface on your back. It
Ah,
hurts. And that's because your tailbone is too posterior, too behind you, so that when you go to lay down, there's a lot of pressure on that.
there's a
So,
lot of nerves in the back there as
yes.
well, so you'll be feeling that through the nervous system as well. So you'll be getting that compression of the nerves. Yeah,
Absolutely. And so then if these bones are not in their original position, so that's my so I started coining this the open birthing pattern in the pelvis. Okay? It's the pelvis is stuck in an open birthing pattern and it hasn't come back to its original position. And so if we think about the anatomy, all of our pelvic floor muscles attach to those three bones that I just talked about, your two
yeah,
sit bones and your tailbone. And so if all of them are widened, your pelvic floor muscles are going to be on stretch. Well, we all know from research that a lengthened muscle is not as strong as a normal length muscle.
yeah.
So
Just
we
the
have
same as
all,
a contracted, when women overdo the Kegels, both
yeah,
both ends of the spectrum mean that it's not functional.
right.
Yeah,
Too tight, too long, not good. We
yeah,
need
yeah, totally.
we need Goldilocks, right? The just
Yeah,
right
just
length.
right. Yeah, yeah.
to get the right strength. And so when you help bring the bones back together, it helps the back pain, the pelvic pain, and it also can facilitate the pelvic floor muscles to be able to strengthen, to get stronger. And the now a lot of times with birth, the bones just open up a little bit. And your body, like after you push a baby out vaginally, there is no sense of normalcy anymore. Like your body, it doesn't know normal. And so there may be this feeling like it feels fine, and you may be fine. You may not have any symptoms until you get pregnant again. And now you have a somewhat open pelvis that's not in
Ah,
its normal position. And now you add the increased laxity, relaxin,
pressure.
hormone, and weight
Yeah.
of a baby. And now you get pelvic pain. So women that come to me pregnant with pelvic pain, the number one question I ask them is, did you have this pelvic pain in your first pregnancy? And if they say no, then I know that that pelvic pain is
And
from
the
that
open
birth.
position. Yeah.
Yeah. And if I can bring their bones back to their original position, their pelvic pain goes away. One session.
That's amazing.
And
I've got a question, Lynn,
yeah,
about that actually. So, what happens if women are lying on their back when they birth? Because in the UK, the kind of standard position is on your back in stirrups. I know because that's what I was put into, even though I really didn't want it the first time.
right, right.
What happens to their bones then?
So what happens is that that sacrum needs to lift backwards for the baby to come on out.
Yeah.
So now what the baby has to do is actually push your entire body weight up
Oh
in
my
order
God.
to come out. And that's why sometimes when baby gets stuck, they bring your knees all the way up to your shoulders. That
Yeah.
lifts the sacrum, that gets the pressure off the sacrum so it can open up more.
Oh, I'm just thinking back to my birth, and there'll be loads of women who have been exactly the same place as I was.
Now, some hospitals they're doing something helpful, but really for not the right reason. I mean, it's a good reason, but there's a better reason that they're doing it and they don't know it, don't realize it. Some hospitals, if you get an epidural, you have to be on your back, right? Depending on the severity of the epidural, your legs don't really work well. So you have to be on your back. Well, some hospitals are actually rolling women and putting a towel roll underneath their hip or pelvis to kind of keep them. They're doing it to keep the blood flow so that you're not
Yeah.
compressing the arteries, the veins coming back to the heart. But actually having that slight rotation gives the sacrum a little bit more freedom to move.
Yeah.
So it's helpful in that regard too, but they're not doing it for that reason. But
Let's
that
just not tell them because we might stop doing
exactly, right? They're doing it right. Yeah.
it.
So if you do have to have an epidural, I would recommend, like get on your side, like you have to get off that sacrum. That sacrum
Yeah.
is, it's meant to go backwards. So it's just so important. And what we need to remember is that the body is amazing in adapting, absolutely amazing in being able to adapt. And what happens though is as it's adapting, function is being lost in some regards. And so for the bones not being in the right position, the pelvic floor muscles are being on stretch. When we have those pelvic floor muscles on stretch, it also stretches out the opening of the vaginal tissue, and that can cause some insertional pain with intercourse. Because
Ah,
with
yeah.
with insertion, the muscles the tissues have to expand to allow the penis in. If they're already expanded and on stretch, there's no more stretch for them to give, and that can be why that
We have,
insertion is painful.
yeah.
So there is an exercise that everybody can do. It's on my YouTube channel. You can check it out. Partners can help your moms do this or your wives to do this. Um, but we use the abductors, so the abductors and the adductors of the hips to help bring the bones back together again. And so if you lay on your back, you bend your knees up, you have your partner put one fist between your knees, and you squeeze that fist as hard as you can for 10 seconds. Do not create pain though. If it creates pain, stop, go the opposite way, try that, and then come back
So
to it.
pushing that way rather than
Yeah.
this way.
Yeah.
Yeah.
There's 3 positions. We want knees together, we want them shoulder width apart, and we want them way wide. So you want to do those 3 positions. One, so if you are trying to close your bones, you do 1 fist, 2 fist, and then the forearm.
And this
Yeah,
one.
like
Okay.
that. Yep.
Yeah, it's
And then
gonna
the
take like this,
Yep,
eh?
yep.
Good.
But however, Abby, we do not want you to do this in seated because we are trying to close those bones on up. We don't want pressure on them. Okay. So that is the optimal. What you just did with your hands and your legs is great, but do it on your back.
Do it on your back. So lying down on your back and supine,
Right.
semi-supine. Yeah.
Right. Yep. So that way the bones are free and you can use those adductors to help bring those bones back together again. And then the opposite is put your knees together and your hands go on the outside and you resist pushing apart your legs. And so you do it knees together, shoulder width, and then wider. Okay. And do it in those 3. 10
So
seconds.
so 10 seconds in each one. How long after birth would this still work?
Do it right after birth and do it forever. It doesn't matter. Like, don't do it forever. You don't have to do it
No,
forever,
but
but
if somebody's never done it and they feel that something's off with their pelvis, then
try
they
it.
try it and just see what
Yep.
happens. I'm
Yeah.
going to be trying this later.
Okay, yeah, because some of the signs that you are in that open birthing pattern, I kind of talked about it, back pain, pelvic pain,
Yeah.
sitting cattywampus, feels like your pelvis is off, that insertional pain with intercourse, pelvic floor muscles don't contract, heaviness vaginally, a heaviness vaginally that does not get worse by the end of the day.
Yeah, because otherwise it's probably prolapse if it's getting worse by the
Exactly,
end of the day. So if it's
exactly.
just a heaviness that's generally the same all day long, then it's more than likely just to be the muscles.
Yeah,
Yeah,
well, think
yeah.
about it. If your bones are wider than they're supposed to be, the pelvic floor muscles are trying to hold them together. That could be what's causing some of that heaviness.
So that would be really interesting for women who think that they might have prolapse if they do this exercise and then see how they feel.
Yes.
It could be that they've self-diagnosed themselves into prolapse when they don't actually have prolapse.
Usually
It would
with
be
prolapse,
wonderful.
yeah, usually with prolapse, it's at the end of the day.
Yeah, yeah.
The heaviness gets worse by the end of the day, and that's true, a true sign of prolapse. But a heaviness that does not change, try this and see if that doesn't change things. Okay.
That's a brilliant tip, Lynn.
Yeah, yeah. So let's talk about some of the other things that I
Yeah.
see that inhibit pelvic floor function after birth. And the second thing would be scar tissue. So anytime we have a tear, an episiotomy, that scar tissue forms to heal that tissue up, and scar tissue is not as flexible as normal tissue. And so it kind of creates this like knot in the tissues. And so massaging that and trying to get that scar tissue to know how to lengthen, because scar tissue forms very haphazardly in trying to heal the tissue, and it really kind of bulks up that area. And when you massage it, it's like you're helping those tissues figure out how to lay down in a more organized manner so that it can function better for you. So taking your fingers, your thumb externally or your thumb internally, your index finger externally, and just kind of compressing the tissues can help it. Um,
So
um,
that's inside the vaginal wall. So doing it inside the vaginal wall, almost
yeah,
like it's a clock face, perhaps, you know. Yeah.
yes.
Yeah.
Most scar tissue. So if you think about it as a clock face, as you are looking at your vaginal space, so by the pubic bone is 12 o'clock, by the anus is 6 o'clock.
Yeah.
The majority of the tears are from 3 to 9 o'clock.
Yeah.
Okay.
And that's generally where you get the episiotomy as well.
Yes.
In that
Yes.
area too.
So we want to like get that tissue flexible, soft and flexible again. So if you did tear, you did have episiotomy, get in there with your fingers. And if you tore on one side and not the other, they should feel the same. So how can you get that thicker, more resistant tissue to soften to be like the other side? That's always my goal. However, I'm working with a client, I'm like, if left side moves, right side should move just as evenly. I'm always comparing left side to right side. So do the same on yourself and try to get that tissue as evenly as possible. Okay.
And they can do this on a C-section scar as well as
Oh,
the
so
mobilizing
important.
as well. Because so
Yes.
many
So,
women are so scared of touching it because it feels weird
right.
after
Well,
C-section.
also not wanting to touch either your scar tissue vaginally or via the cesarean scar is there could be a trauma component to it. And It's really important that we recognize this, because the trauma response not only is in the nervous system, but it's also in the tissues as well. And so if you're having avoidance and you do not want to touch your scar, it gives you the heebie-jeebies, or it gets you emotional, or if you think about your birth, you get emotional, or you keep flashbacking to a certain moment in time, those are all signs of trauma response in the body. And I really encourage you to go work with a trauma therapist and process that birth, because there's ways for you to release that trauma from your body and your system. And the C-section scar is so important. Everybody, please massage your C-section scar. You have to get in there deep and move those tissues side to side, up and down. You could do circles, but you have to get in deep to move all those tissues in order for you not to have 3 issues that can come from C-section scars. The one is bladder frequency. So this can start right away, or it can happen 10 to 15 years down the road. And by this time, nobody's thinking about your C-section that you had 10 to 15
No,
years ago.
they're not anymore. Yeah, that's exactly it. Yeah.
But the C-section scar doesn't allow the bladder to expand. And so it just keeps telling your brain that you have to go because it feels tight and restricted. And that's sending the signal to the brain like you have to pee when you don't really. So massage your C-section scar, that goes away. I talked about insertional pain being a pelvic floor muscle issue. Deep thrusting pain with intercourse is a C-section scar tissue issue, or a cervix that can't move. So deep thrusting pain, if you have C-section scar and you're having deep thrusting pain, get in there and massage your C-section scar. That should go away. And then low back pain is also a big thing. The uterus is attached to the sacrum, and I've never met a C-section scar that's not tighter on one side more than the other. And so if it's tighter on one side, it's pulling that sacrum out and going to cause some back pain. So free up that C-section scar, your back pain can go away. I do have a video also on YouTube on how to massage your C-section scar.
Oh,
So
amazing, Lynn, because we'll put links towards that. Mahesh will stick links into this as well so people can access that. Because I have a lot of clients who ask me, and I did a little tiny course a really long time ago with Jenny Burrell, really long time ago on C-section scars. And so I give a little bit of advice, but I'm like, you really need to dive deeper than my knowledge base, you know?
yes, yeah, it's so, so, so important. And doctors do not recommend this. They're like, there's no research to recommend, but I tell you what, I had a mom who had the same age boys as I do, and our boys were 8 and 10 at the time, and she was getting ready to go camping, and her back went out on her. And I saw her, and I just worked on her C-section scar, didn't touch any other part of her body. She gets off the table, no pain, ready, able to go camping the next day. 2 years later, she had had knee surgery and an ACL repair. So had been hobbling around on a bad knee for
On my,
months, and
yeah.
she developed back pain again. So I laid her down, but this time I was thinking about her knee and not her C-section scar. So I mobilized everything and did everything to her but her C-section scar. I saw her the next day and she goes, no, I still have back pain. I went, oh my gosh. I laid her down. It was at a school picnic. We were in the park. I laid her down on the picnic table.
The best things happen at school picnics.
Right? I laid her down. I massaged her C-section scar, released it. She got up. She had no back pain. So don't tell me there is no benefit to doing C-section scar release work when there is. I see it every
Yeah,
day.
there's so
So
much with adhesions with scar tissue that can cause
yes,
issues like in shoulders and issues in hip,
absolutely.
issues in feet.
Yeah.
I see it in my
They're
clients all the time.
way far away from the scar tissue. It can cause issues and problems. So please massage it. Doctors do not understand fully the impact of scar tissue. It's just not in their training. So
I mean, this is what I say to my clients as well when they come back from seeing a doctor for a checkup because they're worried about having a
yeah.
prolapse. And they're like, well, the doctor said I kind of have a prolapse, but they didn't say me what it was or what grade it was. And I'm like, well, they only get half a day of training on pelvic floor. You know, they're general practitioners. It's wonderful that we have them, but and especially in the UK, because you're part of the National Health Service, but they don't know, you know, and it's,
Yeah.
yeah, yeah.
So that leads me to one of the third issues that I find that can inhibit pelvic floor muscle function. Okay. And that is when a baby comes through the pelvis, it's like, and a client came in and said this to me after she saw me after one session. She goes, Lynn, I went out and I told me it's like you rearranged the furniture in there. And I go, yes, I I do, because as that baby comes on out, it rearranges the furniture, it
Yeah.
rearranges your organs as it's coming out. And I find the bladder gets shifted off to one side. I can find the cervix anywhere in the vaginal space after birth. It can be pulled off to the left, to the right. It can be pulled backwards. It can be poking into your bladder towards the front. It can be anywhere after birth. And ideally, it's supposed to be in the midline. And so
Yeah.
we know children never put anything back where it belongs in the first place anyway, right? The same thing
You
happens with your birth, everybody. It happens to your pelvic organs. So when I find that I move the bladder back into midline, when I help the cervix to release and find its midline position, the pelvic floor muscles instantaneously change and function stronger.
because they've got the right amount of tension on them, because of you've moved things back to where they are, so things
Right.
are tensioned the right way, so nothing's pulling the wrong way, nothing's too lax, nothing's hanging
Yeah.
about the wrong place.
There is something, and I don't even fully know the mechanic of, what's exactly happening in there. But I just know that the bladder and the cervix are intimately connected to the function of the pelvic floor muscles. And when we move that bladder back into midline, and also as the baby's coming through, it kind of drags down that bladder, and it can
There's
also
two.
drag down the cervix. So now everything's kind of a little bit lower. And sometimes the tissues just need a little help coming back up onto the shelf. And what I mean by that is the pelvic bone, the pubic bone, is a shelf of support to the bladder and to the uterus. And when we're in good alignment, it can be this beautiful shelf of support that the bladder and the uterus perch on.
Yeah.
But when we tuck our bottom underneath, now it becomes a slide.
So this is a big thing for women, because when they have pelvic organ prolapse as well, or postnatally, they feel that they've not got the security and the safety underneath, and it's a big part of them, the feeling of safe. They tuck their tailbones under,
Yes.
and
Yes.
that tips everything, so it's no longer sitting comfortably.
When we tuck under, your pubic bone goes from being a shelf of support to the pubic bone to a slide.
Yeah.
So the organs are sliding on out. And another aspect of that open birthing pattern is you don't feel as stable in your pelvic space. So if it really is wide, and another thing I forgot to say about that open birthing pattern, it's more common when you have a baby that is asynclitic or occiput posterior.
Yeah.
So when a baby is not in its optimal position coming through the pelvis, the pelvic bones have to widen more.
So back to back babies, like my ones were both.
Yes.
Yeah.
Yes.
Great,
That's
great, guys.
Yeah, yeah.
Yeah.
So all the more important that we try to work the best we can to create space and balance in the pregnant body so babe can get into a more optimal position to come through the pelvis. Okay, so something to keep in thought there. But
Yes.
when when the baby comes through and it pulls down the bladder and the uterus, sometimes that bladder needs help just coming back up to onto the shelf. So what I love doing with my postpartum clients is making sure the bladder gets into the midline, making sure that the bladder can access and come up onto the shelf, because a lot of times the scar tissue from the tear at the vaginal opening or the episiotomy is actually, as scar tissue forms very haphazardly, it's actually pulling the bladder down and out. Okay, so that is something that is, I don't feel as is in a as wide of an awareness for pelvic floor therapists,
It's
is
really important, because women think that their organs are falling out, but actually their organs, if we mobilize the scar tissue, the organs would be able to return to their position. They're not being pulled and dragged down. Yeah.
yeah. Anna Krall is a physio.
Yeah, I know. Yeah, she's great
Yeah,
at
so
it.
she's had a couple of papers written on this talking about the impact of scar tissue and its pulling effect on the organs. And that, that could be one of the causes of prolapse.
Yeah.
Now, we also know another cause of prolapse is when the tissues have been damaged. that when the tissues have actually pulled away from their insertion onto the bone or to the fascia or the tendons or
This is when we have like levator ani avulsion and things. Yeah.
exactly,
Okay.
exactly. Those avulsions, there's unfortunately nothing that we can really do for that, and that can be another cause of prolapse. But what I want women to understand is that if you are dealing with a prolapse, first off, get help soon and quick. Do not
Yes.
wait months. Do not give it time as your provider might encourage you to do. Oh, it'll get better with time. No, go see a pelvic floor physical therapist. Go work with someone who's trained with me, then they'll know how to get the bladder back into place, get the bladder back up on the shelf, get the cervix released in there so things can be functioning better. If you're dealing with a stage 1, 2 bladder prolapse, a lot of times that's just getting the tissues, getting the organs back into place and releasing any tensions in it. Grades 3s and 4s are typically more about defects somewhere.
Yeah.
Okay. And so, we need to understand that. But the important thing to understand with prolapse is that we can insert pessaries. Pessaries, I want everybody to think of a sports bra for your pelvic organs. Okay, it just
Yeah.
offers support. It's a band-aid. It's some you can leave in for months at a time. You just take it out to clean it every so often. Others you need to take out more frequently, but they offer support to the tissues. And the sooner we can get those tissues supported, the greater their chance is that maybe those tissues might heal in a shortened position.
Yeah.
Then you won't need that pessary long term.
Yeah,
Okay?
so they remodel the tissues, don't they? So they if given
And
a chance to. But if they're
if they
continually stretched and lengthened, they don't get that chance and that time to do it. And if the muscles aren't there to support it because of, say, an avulsion, then you're going to have other issues. So getting the support there quickly is important. And it's a
absolutely.
choice thing with pessaries. You can have one you can take in and out if you feel comfortable with that. You can have one the doctor puts in, and there are a whole range of different sizes and shapes. I always say to women, Lynn, if one doesn't suit you the first time, go back and ask for a different kind because
Amen.
just
Yes.
people just accept what's given to them. And I'm like, if that doesn't suit you, there's gel horn ones, there's donut ones, there's
Yes.
there's so many, there's such a big
There
range of
a
pessaries.
hundred there are 150 different types of pessaries.
I didn't even know it was that many. Yeah.
There's a
So
lot of options out
yeah,
there, everybody, and they're all different sizes. And so it's possible that your doctor gave you the right type, but maybe just the wrong size. And what we need to understand is doctors don't have the time to play around to see if they got the right fit. They give you one here, put that in, and then like it falls out as you're walking out to the car.
yeah, or
And
falls out in the toilet. So I have a lot of women who come and they say, I don't want to put it in. I don't want again. I've done with pessaries. Every time I go
yeah.
to the toilet for a poo, it comes out, and yeah,
And so if you work with here in the States, physical therapists have been given permission to fit for pessaries. And so
okay.
we have more time with our clients to assess to make sure they can still pee when they put it in. Like that's
That's
important.
another thing. Retention's another thing, eh?
Like, so if doctors are just putting one in and like sending you off away and then you can't pee or poop, that's like awful. That's like not okay. So working with a pelvic health physical therapist that knows and understands how to fit pessaries properly is super, super important. So that, know that that's an option, everyone. Know that that's an
Okay.
option. Okay.
And
But
definitely, yeah.
when we get those organs supported better, sometimes that alone helps the pelvic floor muscles contract better. Okay. So I just want everybody listening in to realize that, if you go to a physical therapist and all they do is make you do Kegels and they're not working with your tissues, with your bones, and doing anything, they're just having you maybe putting you on biofeedback and having you do the Kegels. It's like trying to get rid of a headache by beating your head against the wall.
Yeah, I like that analogy. That's a good one. Yeah.
Because really what I find when I go to assess my postpartum clients and I have them do the contraction, a pelvic floor contraction or a Kegel for the first time, I would say maybe 20-30% of the actual muscle fibers can come to the party, can actually contract. Now, if I don't do anything, that's all you're left with. That's all you have. But after I get the bones back in place and I get the organs rearranged and supported
And the
better,
scar tissue
and the
mobilized.
scar
Yeah.
tissue mobilized. By the time in one session, I'm able to get an 80 to 75 to 80% improvement in that pelvic floor muscle strength.
And it's because everything is working together. So we're looking at the whole holistic, we're looking at a woman as a holistic whole body experience rather than just one set of muscles as well.
Exactly, exactly. And the other thing that I focus on too in my course or in my work is the anal sphincter muscle. So the anus, that sphincter muscle is meant to hold that nice and closed.
Yeah.
And if you had a tear, so a grade 3 or grade 4 tear into the anal sphincter. So grade 3s means that it goes into the sphincter muscle. Grade 4 means it goes through the entire sphincter muscle and opens it. Anybody with a grade 3, grade 4 tear needs to see a pelvic floor physical therapist. Ideally, someone who has studied with me so they know how to release the pelvic or know how to release that anal sphincter muscle, because that is a muscle that I find the most knots in after birth. Those knots are, there's usually more than one. And when you have those knots or you have that scar tissue in there, it prevents it from closing fully. So the sphincter is meant to be held tight, and there's a reflex that keeps it held tight. But if we have those knots in there, now things are held open, and that causes you to feel like you can never wipe yourself clean
Yeah. So
because
people
it's never
incontinence. Yeah.
closed
Yeah.
off, so for you to get clean. So it's still held open. You can always feel like you're wiping something, or you don't feel like you empty completely. Those are two big signs that your anal sphincter muscle is not closed and it needs support in trying to release
To
it.
activate. Yeah.
Yes.
So
And
that
so,
would be, so for a lot of women who might think they've got the start of anal prolapse, it might not even be that. It might just be that the sphincter isn't closing.
yes, yes. And you can put your, let's see, you would put your in vaginally and your finger around the anus, and you can go around and kind of squeeze and see if you have any knots. And then you can put your thumb in anally and then your finger outside to do the bottom side too. And it
Yeah.
should be nice and mushy all around. And if you feel a hardness or a thickness in that tissue, just try compressing it and see if you can get it to soften and release. When I'm working with someone, I always talk about using two hands on the body. And so I'll always want to work with that with my other hand on the pelvic bone, which you can't do yourself, or maybe you could, maybe inside lying, put your
Maybe
hand
you
on your
could, yeah, you
tailbone.
could if you were side lying, yeah.
Yeah. Put your other hand on your tailbone as you're working on that, because there's a connection between the two. Okay. And just really work on releasing that muscle. It's imperative. If anybody here is dealing with a fissure is an actual tear in the rectal mucosa that feels like you're pooping glass. And it is awful, awful, awful. It can cause you to have a central nervous system response. You might sweat, you might shiver, you might start shaking. It's just the pain of having a
Yeah.
bowel movement. Super important that you release that muscle prior to having a bowel movement, okay?
So
Because
just release it before you go to the
yeah,
toilet. Yeah.
so if this is your anal sphincter muscle and it needs to open up 360 for you to have a bowel movement, and if you have a knot in it up here and that knot can't open, this side has to open up more, and this is where you're ripping.
And that's where the fissure will be. Yeah.
That's where the fissure is. And so we need to release this knot so that when you have a bowel movement, that there's not excessive strain where that sore is, to
Yeah.
allow it to heal, so that this whole thing can open up evenly without excessive strain on that tear. So
I have a client that's going to love this information, Lynn. You know,
great,
she's
great.
been struggling with an anal fissure for a while. So
And
yeah.
all the doctors do is give you your ointments.
Yeah, that's
And
all she's been given is ointment. Yeah.
the ointments don't change the mechanics. Every
No.
time she has those knots, the fissure is always opposite the knots. So if you know
Yeah.
where your fissure is and you can feel the pain, go opposite it and try to release that muscle and see if that doesn't, I've worked with clients before I realized this, and it takes them months to heal a fissure. I started doing this and I had one client within a week heal,
That's
because
amazing.
she was so on top of it and so able to release the muscle that the tissue was able to heal. Normal tissue takes 5 to 7 days to heal. But
Yeah.
if you keep adding adds excessive strain to it, it's going to keep ripping it open. And that's what's happening when you're
And
having a
it's never
bowel.
going to get to that healing stage. It's just going to get
Exactly.
just because you're going for a bowel movement every day, most people.
Yep.
Um, so yeah, and every time you're going to be causing, yeah.
And you're not, even if soften your stools, get them more diarrhea like, you go back to having more solid stools and it's going to open up again.
Yeah, because you've not actually changed the mechanics of it. Yeah,
Got it. You
yeah.
got it, Abby. Yep, for sure. So, and the sphincter muscle is all part of the pelvic floor muscles. So if the sphincter muscle is holding tension in it, then that is going to limit your ability to strengthen your pelvic floor muscles. So all these things, you got to work on all of it together. And that's what I address in all my sessions. And that's what helps me to get that massive improvement of pelvic floor muscle strength in one
It's a
session.
curiosity, isn't it? It's a curiosity about your own body and not being ashamed of your own body and feeling and being part of it. And that's how a partner could support you as well. If you want to, if a really good way for them to be part of the journey with you is for you to use them to do the massage as well.
Yes.
I know not
Yeah.
all partners will be comfortable with that, but there will be
Right.
some out there, you know.
Yeah.
I know, yeah, I definitely know some men that are very comfortable with making sure that their partner or wife heals really well as well and isn't uncomfortable
Yeah.
doing it.
And that's awesome to have a partner who is willing to, and it's okay if your partner wants to just keep this
Yeah, totally.
area a
Yeah,
section at
totally.
a time,
Both, you know.
right?
Yeah.
Yeah, because like there's some guys who are like, I don't want to get all technical and work with that stuff. I want it to just be pleasure for us, like that. So
Yeah.
I want to give permission for those that
Both,
like,
yeah.
well, I just had someone say that. And I was just like, oh, that's a really good idea. Because I always like, oh, let's bring the partner in. But not all partners want to go there. So just know your partner and it's okay. There is support with practitioners. So
There are
if
some, yeah, and practitioners that you've trained as well, and they're all around the
yeah,
world now. I know that you've got practitioners almost everywhere now.
yeah, unfortunately they're not all in my directory. I do have a directory of people that have trained with me and have completed my courses. So you guys can check there. I've trained over thousands of therapists, but I only have over 200 in my directory. So getting my students to fill out their directory has been a challenge for us. So we're trying to figure
Yeah,
out a new
I know
way.
it. Same with my students. It's a challenge to get them to fill it
Yeah.
out
So
so I can add them.
right.
Yeah.
So there are I also have a Facebook group, Institute for Birth Healing Community. You can reach out and see if there's anybody who's studied with me. And if you are seeing a practitioner and they're not doing any of these things that I'm talking about, encourage them to take
Your training.
my holistic postpartum. They need to take my holistic postpartum body course because that will do all that intravaginal work that I was explaining here. That's
Yeah.
covered in that postpartum body course. So encourage them to go take it, guys. It's 8 hours. They can do it in a
It's really
weekend.
important because it'll open up a whole realm of possibilities for them with the women that they're treating. And people
Yeah.
don't come into being pelvic floor physios because, they don't want to help. It's about
Right.
giving them the tools and knowledge as well.
Yeah. And
We're talking,
it
sorry,
just well it just I'm just so pleased the results that my students are getting. They're getting the same results as I am. So it's not just me, everybody. You can learn this material and they can apply it to your body. So really encourage your practitioners to take these courses.
yeah, I mean, it was one of the biggest things for me postnatally was I have a friend, she's now a friend, but she did internal massage for me and she actually moved all my organs back up because they had all pulled down the way you were describing. And
Yeah.
so she put everything back up and it felt like my body shape changed because
Yep.
everything, it felt like my whole body had moved down.
Yeah.
So I guess listeners, if that's something that you've noticed about your body, that you don't get into your old jeans or any clothes because
Yeah.
your pelvis is the wrong size, it was a big
It's
thing.
gone this way. And so,
Yeah.
yeah, that is definitely one of the patterns is the sacral posterior sacrum where the ilium widen out to the side as baby comes through. And it's more common with OP babies.
Yes. Yay. So
I know. Lucky me. Lucky
lucky
me.
me, both of
Yeah.
them.
Yep.
So you were
But
talking about pregnancy, preparing people during pregnancy so that back to back doesn't happen so predominantly.
yeah.
Things you do with pregnant women for that.
the the biggest issue, two big things that we got to look at is the uterine mobility and the uterine ligaments. We got to create space and balance for baby. And if you're noticing your baby only hanging out on one side of your belly, that's a sign of a restriction. Babe should be able to get on both sides of the body. And if your babe's only been hanging out on one side, that's a sign there's a restriction. When baby is off center, and we need to make sure as your baby's head goes down that it's going directly down into the midline of your pelvis and not off into one hip. If it's going off one hip, then your baby's in there a little crooked, and the uterus has to work so hard to get it into the opening. So when it starts at the opening, then it's so much easier for the uterus to get the baby out. So we're talking about hours and hours of labor if we can just help that out. And baby's head is off to the side. Baby goes where there's space. So there's either tension pulling it that way or tension that it's avoiding. And so we need to address that and make sure, like if you're pregnant, put your hands on either side of your belly. Can you push the belly evenly to one side, and can it go the same distance to the other side? It should be even side to side. There's two other rotations that I assess to check out some of the other uterine ligaments, but that's a big one. And,
Side to
you know,
side.
yeah, and we want to make sure that the baby's head is down and the fundus or the top of the uterus is directly above it. If the fundus is off to a side, that's a round ligament issue. And if the baby is going out, the uterus is more side to side versus up and down, that's a bilateral round ligament tension. So the baby's position in the belly. The other thing you can look at is that linea nigra, the brown line. Not everybody gets it, but it comes later on in your pregnancy. And
Descending. Okay.
that line, yep, it goes straight from your pubic bone up through your belly button and on top. And it should be vertical. It should be straight. If you notice it kind of curves off to like comes up towards the belly button and it curves off to the right, that's telling us you have tension in that side rib cage. If it comes down and it curves away from the belly button, that's telling you have side in that hip and tightness in that hip. So there's all these clues that the baby gives us when we're pregnant as to where there's restrictions, where there's tightness in your body, and all of it can be addressed prior to going into labor. Spinning Babies does an excellent job of helping you to find balance and in your belly with being pregnant. They have the three sisters they talk about that you should be doing on a regular basis to try to keep balance. And if that is not correcting or causing babe to be in a good position, then please go get body work. I think it's helpful for anyone who's pregnant to be seen by a pelvic floor PT who knows how to address the uterine ligaments to create space for baby, and also knows how to release your pelvic floor muscles, because the pelvic floor muscles are the stoplight for birth. They, if you've got red light tone in there, they are so tight that baby is not coming out. You are
Yeah.
going to need an epidural, and sometimes even that doesn't help. So that we got to get rid of that red light tone. Yellow light tone just means there's some tension in there. It's going to make it a little bit more challenging for baby to come on out. We want green light tone where it's nice and flexible and bouncy, like you're pushing down on a trampoline and it comes up. That's the type of mobility we want in those pelvic floor muscles. And it needs to be even side to side. Remember when I was talking about the splay of the sit
Yeah.
bone out to the side? Sometimes that happens because the one side's too tight, so that can't open. So the other side has to open up more. So having balance in the pelvic floor muscles, green light tone in the pelvic floor muscles is going to be more of an invitation for babe to come on out. And the other important thing to avoid tearing or a grade 3-4 tear is to really work on learning how to effectively push and lengthen your pelvic floor muscles. So this is something you and your partner could work on during pregnancy, is if your partner puts his 2 fingers in, goes on either side of the bowel. Okay, so at 6 o'clock is the bowel. If his fingers come in on either side and reaches back as far as they can, and then you practice pushing his fingers on out, when you
Ah,
push, the muscles should lengthen and come on out. If you're pushing and you're tightening the pelvic floor muscles, that is counterproductive for your birth and is a greater signal or a chance for having grade 3-4 tears, because you're fighting the system. If you're pushing down and you're tightening your pelvic floor muscles, your baby's just getting squashed in between. We want to make sure that those pelvic floor muscles can lengthen and come on out. And that's exactly what needs to happen for a bowel movement. So if you guys can practice, how do you push your stool out? How can you effectively lengthen your pelvic floor muscle for your stool to come on out? That's exactly what needs to happen during labor.
that's
And
really interesting. I wish I'd known this before I had my babies. So, I mean, that's a big thing. So, a lot of women, they go to birth preparation classes for what happens, but they don't actually go and see somebody to look at their bodies and see how their bodies are. So, it's very important that we encourage women. If you're pregnant now, or if you're in between and you're thinking about having another baby, then to go and see a pelvic floor physio therapist who can do.
Yeah. And
Yeah.
Abby, you want to know the most interesting thing is that when I teach this in my classes, so I have physical therapists who know all about the pelvic floor muscles, and I have my clients on the table. Do you know the worst position to try to figure out how to lengthen your pelvic floor muscle is in?
No, lying on your
On
back.
on your back.
Yeah.
On your back is the hardest position to figure out how to lengthen your pelvic floor muscles. So if this is something that you've done, so when I have someone come in and I'm trying to get their pelvic floor muscles to lengthen with the pushing, and we start on the back with their knees bent up, very similar birth position that they might be in if they birth in a hospital, and they just can't figure it out. So then I'll get them into side lying and we'll practice in side lying, and then they start to get it. And they're like, okay, yeah, that's a little better. Then we get them into hands and knees and we practice in hands and knees, and that's a little bit easier for them. And then we get them into tall kneeling, and then they really get it because tall kneeling is just like pooping. So
Yes.
their body is more used to releasing and letting go in that tall kneeling position. It's not used to letting go when you're laying on your back. So once we figure it out, then we bring them back down through all those different positions and encourage them and get them to figure out how to lengthen being on your back, because it's not practice. And the majority of people doing it are tightening. And like I say, it's happening even in my courses as I'm teaching this to physical therapists who know all about their pelvic floor muscles.
Yeah.
So, I say that to say it's not a bad thing that we don't know how to do it. It's just not a functional thing that we do.
It's also just not something that's ever taught. We're not taught
Ah,
all these things. And it's like almost like you find out after you've had a baby and after you've had an issue, you discover that there were things that you could have done because it's not
absolutely.
talked about enough, in our society at the moment, which is another reason why we're doing these talks. And I know it's why you do the Birth Healing Summit as
Yep.
well, because you have
Yeah.
so many practitioners on there as well. And that's a really amazing resource for people too who are listening to this, because Lynn does every year this Birth Healing Summit that's just amazing with so many different practitioners from all over the world. And it's a mine of information.
Yeah.
Yeah.
It's been
So,
fun. I've
any
learned a lot.
last thoughts, Lynn, about anything
Oh,
that you'd really like to share, and then how our listeners can get in touch with you as well?
yeah, I think for last thoughts is I just want moms to know, to hopefully help them to feel more empowered during the birth process or being pregnant. Like, get your body assessed, learn how to push. That's so important during pregnancy. And then no matter how long it's been, how old your baby is, healing can always happen.
That's what I
Okay.
say all the time. Yeah.
Healing can always happen, and recognize too the impact of trauma, that if you do the closing of the bones exercise, squeezing your knees and but it doesn't seem like it's changing anything for you, there may be a trauma response in your body that is keeping your body held in that position. There's a freeze response in birth. The body goes fight, flight, freeze. Well, in birth, you can't fight it and you can't flight from it. So freeze is
You
the body's
freeze.
only option. And so it's stuck in this freeze response, and you may need to do some work to release that trauma response in the body first in order to allow your tissues to heal better. So keep that in mind, everybody. And
Yeah.
if anybody is interested in my partner Mary Jean and I do online virtual sessions to healing birth trauma. So you can reach out for that. And I
That's
do
brilliant.
see clients one-on-one in the Boulder, Denver, Colorado area and the States. And centerforbirthhealing.com is my clinical site, and that's CENTER, not RE, like you guys like to over in the
Yeah, yeah, yeah,
UK.
yeah, yeah.
Centerforbirthhealing.com is my clinical practice. Instituteforbirthhealing.com is my educational platform. And that also is where, under additional resources, if you click on that, the directory will be underneath that
Oh,
tab.
brilliant. Good.
and you guys can check that out and see if there's anybody nearby you. And where are you at, Abby, again?
I'm in Scotland,
You're in
I'm in
Scotland?
Scotland, and Philippa, one of my other co-pilots, is in Sweden, and Mahesh is also in Sweden. And
Oh,
then we've got
great.
Trista is also involved with us too, and she's obviously, you've talked to Trista before at the summit. She's in Canada.
Yeah.
So yeah,
Awesome.
so we're
Yay.
all kind of,
Yeah.
it's like a family of all of us trying to make sure that women are better informed, and once they're
Awesome.
better informed, they can educate themselves
Great.
and
Yeah.
take
Awesome.
take the right paths. So
I
it's going to
love
be
that you're doing
interesting.
this. I'm coming over to the UK to teach next year. Hopefully, it's not finalized, but we're working on it. So hopefully we can get some of the European therapists. I know some have taken my online courses, but I'm actually doing a live in-person course, hopefully in the UK next year to
I know
educate.
for me, it'd be amazing to have people to refer people to in the UK. So
Yeah.
yeah,
There's actually there is a gal that has studied with me from Ireland. She came over and took both of my courses. So I know I do have someone in Ireland. I think it's in the Dublin area or just outside of it. So
oh, that's
um,
good. So
yeah,
yeah, we have lots of people from Ireland within our group already, but there'll be other women listening to this as well. So,
yeah,
but it's been an
awesome.
amazing experience speaking to you. You're such a fountain of knowledge, Lynn. Honestly, you really
Thank
are.
you.
So, and
It's
thank you
just
so much.
Thank you for having me, and thank you everybody for listening and learning. And please share this with other moms. Let's get this information out so moms know that they're not crazy, they're not broken, that they can be helped and healed, and there is support for them. So thank you, Abby, for doing this to get this
Yeah, they're
information.
definitely not broken. That's a big thing for me. You're not broken, you're just starting to heal, and that's really important. Yeah, that's a big thing for me. Yeah,
Thank you.
okay. I'm gonna
Awesome.
stop the recording now and just say bye properly without the recording on.
All right.